السلام عليكم ورحمة الله وبركاته. Surgery in Geriatrics, a lecture by Dr. Mohammad Algazar, lecturer of general surgery. Aging is a progressive, intrinsic, universally prevalent physiological process, producing measurable changes in the structure and function of the tissues and the organs. Meaning that the aging leads to affection of the function of the organs. Affection of the function of the organs, like vital organs like cardiovascular system, renal system, respiratory system, will affect the outcome of surgery, increasing the number of morbidity and mortality cases after surgery. This also explained by the older population have comorbid conditions like ischemic heart diseases, heart failure, diabetes, liver failure, renal failure, and whatever. So these older patients may increase the number of the organs failure post-operatively, which is called multi-organ failure, leading to increasing morbidity and mortality of surgery. The other problem in the elderly population is that these patients need emergency surgery more than the younger populations. The emergency surgeries represent about 60 to 85% of the surgeries done for the elderly patients, unlike the number of emergency surgeries, which is about 40% of the cases in younger population. Reflecting that the emergency surgery has a higher mortality and a higher morbidity than the elective surgery. The mortality rate, for example, the mortality rate in younger populations in the elective surgery is 5 to 10%, while in the emergency surgery is 20 to 40%. This is in the younger population. In the high age group, patients more than 70 or more than 80 years, the number is increased dramatically. Up to 60 to 80% of the patient undergoing emergency surgery maybe die from surgery, and this is a problem. This is a big issue. What's the cause of this big issue in the elderly populations? This big issue due to specific problems in this age group, like the cardiovascular system. Cardiovascular system problems are common in the older populations due to heart muscle replacement by the fibrous tissue. Heart muscle replacement by the fibrous tissue, increasing the function of the heart, leading to increasing the incidence of heart failure post-operatively. Also, the valves of the older population replaced by the fibrous tissue, leading to calcification, like in the aortic valve, or liquid degeneration of the mitral valve, and this affects the function of the heart. Also, the cardiac output decreases in the older population. In the patient age group from 74 to 84, there is a fall of the cardiac output by about 80%. This leads to decrease functional capacity and decrease the adequate functional capacity, which and this will affect the functional capacity of the patients who decrease reserve, which made the stress of surgery, and this all increase the incidence of the congestive heart failure post-operatively in the patient undergoing surgery, which increase the mortality of this patient. Also increase the incidence of myocardial infarction cases, cardiovascular events, which affect the patients, leading to heart deaths or mortality rate in the older population. Also, older populations have conduction defects like six-sinus syndrome, bundle branch block, and the AF, and these arrhythmias, leading to increase the mortality and morbidity post-operatively. So, preoperative precise evaluation of the cardiovascular system is important in the elderly population, and the post-operative monitoring, close post-operative monitoring of these patients is important for early detection of the of the cardiovascular events and to avoid this mortality in the older population. It's important detection of myocardial infarction, congestive heart failure, and arrhythmias in this age group post-operatively is very important. The nervous system, one of the systems which is affected by the aging group, decreasing creatinine clearance, and this age group is reflected by increased creatinine level. So the creatinine level doesn't reflect the function of the kidney except if it's adjusted with the age. In the normal population, the normal creatinine level up to 1.2 milligram per deciliter. In the older population, it may reach 2 milligram per deciliter, which is normal in this older population. We have two issues in the older population in the perioperative period to avoid the post-operative renal failure. Fluids, adjustment of the fluid level which is taken by the patients during surgery and the post-operatively to avoid the volume overload which leads to renal failure, and avoidance of the nephrotoxic drugs. Nephrotoxic drugs which affect the kidney directly post-operatively. These nephrotoxic drugs lead to renal failure. So avoidance of the nephrotoxic drugs to avoid the renal failure, which is increased in the older population due to decreasing creatinine clearance, decreased clearance of the kidney due to decreased functional capacity of the kidney in the older population. So we have two important issues to avoid the post-operative renal problems in the older population: avoidance of volume overload and nephrotoxic drugs. In the respiratory system, there is increase in the fibrous tissue in the old age and the decrease in elastin, alveolar septal breakdown, and chest wall calcifications. All of the above leads to decreased compliance of the lung and also of this elastic recoil, increased ventilation and perfusion mismatch. Normally, we know that the respiration and expiration due to elastic recoil of the lung, elasticity of the lung, decrease the elastic recoil of the lung, decreasing the functional capacity and the affection, the respiration and the expiration. So the decreased compliance and decreased elastic recoil in the elderly patients leading to postoperative hypoxia and postoperative apnea in this older population. Preoperative respiratory exercise and respiratory toilet leading to decrease of postoperative respiratory complications using a spirometer, especially in the upper GIT operations, which decrease the respiratory movements. Upper GIT operations leads to limitation of respiratory movements due to pain. Patients must be trained to do respiratory toilet by coughing and pack blues and using spirometer to avoid postoperative respiratory complications. Postoperative respiratory complications may include pneumonia, which has a higher mortality rate in the surgical populations. Hepatic function is affected in the older patients. There's decrease in the hepatic mass by about 40% by the age of 80, but the function of the liver is preserved. When we do the liver function tests laboratory, the functions of the liver are normal, but there is affection of some microsomes which share in the metabolism of some drugs. So titration of the dose or adjustment of the dose of these drugs postoperatively in older population must be done as like acetaminophen or paracetamol, which is metabolized in the liver. The dose must be decreased up to 4 grams per day. In the normal adult population, the toxic dose of acetaminophen is about 15 grams per day, but in older populations, the toxic dose is 4 grams per day. Thromboembolic diseases, about 20 to 80% of the patients undergoing surgical operations without prophylaxis develop DVT. In this instance, increase up to 40% in patients undergoing hip or knee surgery or pelvic surgery, like gynecological operations in females or prostatectomy in males. Reflexes against DVT is important, especially in elderly population. Fatal pulmonary embolism account a larger proportion of operative deaths in elderly populations. طبعا prophylaxis against thromboembolism is a vascular topic, but for refreshment, early evaluation postoperatively is an important issue to prevent thromboembolic diseases. Elastic stocking, preoperatively elastic stocking decrease the incidence of DVT. Pharmacological prophylaxis with low molecular weight heparin like fondaparinux is important in major operations or high-risk patients for DVT, like cancer patients or patients undergoing knee, hip surgery or pelvic surgeries. But adjustment of the dose of the low molecular weight heparin in elderly population with the renal function tests. So renal function tests must be done preoperatively in elderly population before giving low molecular weight heparin as a prophylaxis against DVT, because it affects the renal function. Neuropsychiatric problems like dementia, delirium with depression, which are common neuropsychiatric problems in the elder populations, especially depression and dementia. About 15 patients with hip fractures have dementia. Depression also common in hospitalized patients, increases with acute illness and increases with complications of surgery. Depression increases with complications of surgery. So preoperative assessment of the mental status of the patient and the early postoperative detection of neuropsychiatric complications in this patient is crucial to avoid high mortality and morbidity. Diabetes is a big issue in surgery. Diabetes affects the general condition of the patient and locally affects the wound of the patient. Generally affects the cardiovascular system. Diabetes is linked with the coronary heart diseases, ischemia of the heart and the myocardial infarction. Patients with diabetes have a moderate risk of myocardial infarction postoperatively. And also diabetes increase other cardiovascular events like the stroke in elderly populations. Renal failure also, because due to angiopathy of the renal arteries. Diabetes also affect the wounds, delayed wound healing and increased wound sepsis, increased wound infection in diabetic patients. So optimum controlling of the blood glucose level is important. The blood glucose level must be less than 300 milligram per deciliter, and it's preferred to be less than 200 milligram per deciliter, especially in cardiac operations, to avoid complications of the wound. Strict control of the glycemic control of the blood glucose level in postoperative period is important to avoid these complications. But this strict control must be taken cautious, because hypoglycemia leading to cerebral ischemia and death of the patient. So we must outweigh the benefits of strict perioperative control of the glucose level with hypoglycemia. So what to do in general for elderly population? For elderly population, preoperative cardiac assessment, assessment of the renal function, assessment of the liver function, controlling of the blood glucose level, and hydration imbalance must be conducted. Close monitoring of the elderly patients postoperatively is essential. Another issue in the post-operative period in elderly population, post-operative pain. Pain management is a critical important in post-operative period in surgery. Depression, anxiety, fear, and fatigue are factors that affect the perception of the pain, and these complications are common. Depression and anxiety are common in elderly population. So we must control the pain adequately in this older population. The pain medications should be taken with regular intervals, and there is additional doses for the breakthrough of the pain. In other populations, opioids are not avoided, and the risk of addiction for opioids in acute pain syndromes is small. But some opioids, like morphine, affect the respiratory center and may lead to respiratory center depression. So it's better avoided in elder population. Opioids which affect the respiratory center should be avoided. Mibridine and propoxyphene should be avoided because of toxic metabolite accumulation in the elder population. So we must avoid the respiratory center depression opioids like morphine, and must avoid mibridine, propoxyphene due to its toxic metabolite accumulation. As we said in the hepatic function, acetaminophen, paracetamol, those should not exceed 4 grams per day in older population, even with normal liver function patients, to avoid toxicity of acetaminophen, which leads to acute liver failure. Thank you.